Hello and welcome to Rajya Sabha TV. I'm Tina Jha with News Tonight, where we get you all the news and updates from across India and the world. 1,018 new cases of coronavirus have been reported from across different parts of the country in the last 24 hours, taking the total number of COVID-19 cases in the country now to 33,050. This includes nearly 25,000 active cases of coronavirus. According to the Health Ministry, the recovery rate in the country has now improved from 13.06% 2 weeks ago to 25.19% today.
हमारे देश में केस फैटेलिटी करीब 3.2% नोट की गई है, जिसमें से 65% मेल और 35% फीमेल पेशेंट्स थे। अगर हम मोर्टेलिटी का एज डिस्ट्रीब्यूशन भी देखें तो पाते हैं कि लेस देन 45 इयर्स एज ग्रुप में 14% केस फैटेलिटी हैज बीन नोटेड। 45 से 60 इयर्स एज ग्रुप में 34.8% केस फैटेलिटी हैज बीन नोटेड और 60 इयर्स के अबव एज ग्रुप में 51.2% केस फैटेलिटी हैज बीन नोटेड। उसमें भी अगर हम देखें कि 60 प्लस एज ग्रुप को अगर हम दो भागों में डिवाइड करें तो 60 to 75% में 42% केस फैटेलिटी हैज बीन नोटेड और अबव 75 इयर्स में भी हमारे पास 9.2% केसेस में केस फैटेलिटी नोट की गई है।
The Health Ministry has also requested states to ensure continuation of non-COVID related essential services, including immunization, maternal and child health services, and services to prevent communicable and non-communicable diseases.
प्राइवेट क्षेत्र के कई अस्पताल अपने रेगुलर पेशेंट्स को डायलिसिस, ब्लड ट्रांसफ्यूजन, कीमोथेरेपी और इंस्टीट्यूशनल डिलीवरी जैसी क्रिटिकल सर्विसेज को देने में किसी कारणवश भय की वजह से या लैक ऑफ अंडरस्टैंडिंग की वजह से कभी-कभी संकोच कर रहे हैं। वह अपने इस डर से अपने हॉस्पिटल और क्लिनिक्स को भी बंद कर रखे हुए हैं। उन स्थानों पर कई जगह पर देखा गया है कि वह सर्विस प्रोवाइड करने से पहले टेस्टिंग के लिए भी इंसिस्ट कर रहे हैं। इस विषय में यह हाईलाइट किया जाता है कि जिन भी क्रिटिकल सर्विसेज की देश में आवश्यकता है, सभी हेल्थ फैसिलिटीज विशेषकर प्राइवेट सेक्टर ये फंक्शनल बनी रहे और किसी भी पेशेंट को किसी भी तरह की कठिनाई का सामना ना करना पड़े।
Earlier, Union Health Minister Harshvardhan had interacted with representatives of civil society organizations and NGOs via video conferencing to discuss the COVID-19 pandemic. Discussions were held on the post-lockdown scenario, physical distancing, food for migrant laborers, and collaborative partnerships. The Health Minister said that social distancing is the most potent vaccine available right now to fight this pandemic. He also informed that over 100 manufacturers are producing 1.5 lakh PPEs every day, and more than 1 lakh N95 masks are also being produced weekly to ensure adequate supply across the country. Niti Aayog CEO Amitabh Kant was also present at the meeting.
To be a huge transfer of these migrant laborers and other stranded people all across the country. So this will involve a lot of movement of people from one place to other place, and there will be a requirement of a lot of help from the society to reorganize them again back in their own hometowns to ensure that they are adequately quarantined, tested, given the right guidance and proper cooperation from the society, because there could be some resistance in the society when they go back. So this is where I see a very, very strong and positive and dynamic role from you all.
The inter-ministerial central teams are in Hyderabad and Chennai to review the COVID-19 situation there. According to the Home Ministry, all hospitals and other areas are following necessary protocols in tackling the COVID-19 situation in both these cities. The Hyderabad team visited the containment zone in Humayun Nagar, where essential goods and services are being provided through door-to-door service, and the police is using drone technology for surveillance. The Chennai team has reported improved recovery rate and migrants satisfied with shelter facilities arranged for them.
उन्होंने पाया कि राज्य के पास पर्याप्त मात्रा में टेस्ट किट्स, पीपीई किट्स इत्यादि उपलब्ध हैं। राज्य सरकार एक एंड टू एंड आईटी डैशबोर्ड यूज कर मरीजों की टेस्टिंग से डिस्चार्ज तक ट्रैकिंग कर रही है। उन्होंने गांधी अस्पताल भी विजिट किया जो कोविड-19 के लिए स्टेट नोडल सेंटर है और यहां टीम ने पाया कि इलाज और डिस्चार्ज के सभी प्रोटोकॉल्स का अनुपालन किया जा रहा है। ने पाया कि तमिलनाडु में रिकवरी रेट काफी अच्छी है। 2058 संक्रमित मरीजों में से 1168 यानी कि 57% लोग ठीक हो गए हैं। प्रवासी श्रमिकों के लिए रिलीफ कैंप्स में उन्होंने पाया कि व्यवस्था अच्छी है और श्रमिक सुविधाओं से संतुष्ट है। टीवी, मेडिकल चेकअप और काउंसलिंग की सुविधा भी उपलब्ध है। लॉकडाउन के दौरान लोगों के लिए कैंटीन द्वारा भी दिन में 3 बार भोजन की व्यवस्था की जा रही है। लोगों को वित्तीय सहायता, मुफ्त राशन तथा सब्सिडाइज रेट पर आवश्यक खाद्य पदार्थों के किट भी दिए जा रहे हैं।
Prime Minister Narendra Modi on Thursday held a meeting on bringing foreign investments into the country. Finance Minister, Home Minister, Commerce Minister and Minister of State for Finance attended the meeting along with senior officials. The meeting focused on promoting domestic sectors to give a boost to the economy in the wake of COVID-19 pandemic. Detailed discussions were also held on guiding states to evolve strategies and be proactive in attracting investments. Schemes to promote more plug-and-play infrastructure in the existing industrial lands, plots or estates was discussed in the meeting. The Prime Minister stressed on a more proactive approach to handhold the investors and help them get all the necessary clearances in a time-bound manner. It was also discussed that the reform initiatives by various ministries must continue and any obstacles to promotion of investment and industrial growth should be removed. Talking about the COVID situation across different states, with the number of coronavirus cases now nearing 10,000 in Maharashtra, the state government on Thursday issued stricter directives to all hospitals in the state on treatment of COVID-19 patients. The new rules call for sending asymptomatic patients with no comorbidities to home quarantine. They also give top priority to swab collection and assigning unique IDs to patients. Patients checking into hospitals should immediately be screened and, if needed, shifted or admitted. In the case of a death, the body should be shifted within 30 minutes from the ward and the last rites carried out within 12 hours. Maharashtra Chief Secretary Ajoy Mehta said the directives will come into force from 10 a.m. on the 2nd of May this year. Meanwhile, 2 days after the Home Ministry issued its new national lockdown guidelines, state governments are getting ready to transport stranded migrants, students, pilgrims and tourists among others. In an order released on Thursday, Maharashtra appointed nodal officers for each district to facilitate the movement of people interstate. Over 6.5 lakh migrant labourers, most of them from Uttar Pradesh and Bihar, are stranded in the state. The government also deployed 70 buses to bring back over 1,700 students stuck in Kota in Rajasthan. Bihar, Jharkhand and some other states have also designated nodal officers to prepare lists of stranded people. In Madhya Pradesh, 20,000 labourers stranded in other states have been brought back. The Jammu and Kashmir administration is bringing back 17,000 labourers, students and others from various parts of the country. Karnataka is allowing interstate movement, especially for students and migrant workers. In another development, Punjab and West Bengal have said restrictions will continue after 3rd May but will be eased in non-containment zones. UP Chief Minister Yogi Adityanath also announced that green and orange zones are likely to see a gradual easing of the lockdown from the 4th of May. However, he reiterated that no social gathering will be permitted till the 30th of June. The Meghalaya government has declared 10 of the state's 11 districts as green zones while allowing inter-district movement. Nearly 33,050 confirmed cases of COVID-19 have been reported in the country so far. After Maharashtra, Gujarat has the highest number of cases at 4,082, followed by Delhi at 3,439. Other states that are seeing a sharp rise in cases are Madhya Pradesh at 2,561, Rajasthan at 2,438, Tamil Nadu 2,162 and Uttar Pradesh at 2,134. COVID-19 cases have also gone up to 1,332 in Andhra Pradesh and 1,012 in Telangana. The University Grants Commission has released new guidelines on examinations and academic calendar for universities in the wake of the COVID-19 situation in the country. Academic session 2020-21 for all students may commence from the 1st of August, while for new students the date is the 1st of September 2020. Grades of intermediate semester students will be based on internal assessment of the present and previous semester. In states where COVID-19 situation has normalized, exams for terminal semester students can be held in July. The UGC announced the guidelines on Wednesday based on the recommendation of 2 expert committees. The guidelines are advisory. Every university will have a COVID-19 cell which will be empowered to solve the issues of students related to academic calendar and examinations. A similar cell in the UGC will ensure faster decision making. The UP Education Board has decided to air special classes on DD Swayam Prabha for students of class 10 and class 12 starting Friday. These classes will be in addition to the ongoing online classes and will be aired for 2 hours from 10 a.m. to 12 noon every day. 4 classes will be conducted, 2 for class 10 and 2 for class 12 students. Each class will last 30 minutes and will be repeated in the evening. The step has been taken due to the academic calendar being severely impacted by the coronavirus pandemic. Switching from military supplies, the Ordnance Factory Board is now focusing on supplying medical equipment in India's combat against COVID-19. Speaking exclusively to Rajya Sabha TV, Chairman of the Ordnance Factory Board, Hari Mohan, said its immediate plan is to manufacture and supply more than 1 lakh coveralls. Listen in. Chairman of the Ordnance Factory Board, Hari Mohan, says that the ordnance factories have developed a critical technology that can test the resistance of the material used in protective clothing to penetration by synthetic blood.
And the biggest limitation in terms of PPE was its testing facility. Every manufacturer who is manufacturing cloth and stitching the garment, that is the bodysuit, both require their product to be tested by synthetic blood penetration test resistance. And this facility is available, duly certified by NABL, only in one place, that is called Coimbatore, South India Textile Research Association's lab. From 29th March to 11th April, that it means just 13 to 14 days, we have conceptualized, we have designed, we have manufactured, we have refined the design, and we have got this facility accredited from NABL, that is the highest standard for any lab.
The OFB also developed special 2-meter tents for use in medical emergency, screening, hospital triage and quarantine purposes. These are made of waterproof fabric, mild steel and aluminium alloy.
Within a period of 3 days, they have redesigned the whole tent, and they have brought down the cost of this tent by 30%. The tent is costing only 70%, and this tent has come out so well that it has already been taken by government of Arunachal Pradesh, government of Orissa, government of Punjab. And this tent is available. The beauty of this tent is that it can be erected very quickly, and you can extend the number of beds near your hospital. This is a portable isolation ward which you can create. Suppose you find it inconvenient, if you want to shift it, you can shift it.
The OFB is India's main producer of military arsenal. It controls 41 factories that produce artillery guns, tanks, armored personnel carriers, bombs, rockets, anti-aircraft guns, parachutes and small arms. Kriti Mishra's report for Rajya Sabha TV. And worldwide, the total number of COVID-19 cases have crossed the 3 million mark, while the death toll now stands at 2,25,000. The number of deaths in the US reached 61,669 after 2,502 people died in the last 24 hours. America has 10,64,572 positive cases of coronavirus. In Italy, the pandemic claimed over 27,600 lives, with infections touching 2,03,591. The United Kingdom reported 26,097 deaths due to COVID-19. At least 1,65,000 people are infected by coronavirus across the country, while Spain recorded 24,275 deaths due to COVID-19. The total number of positive cases in the country has reached 2,36,899. Meanwhile, Russia on Wednesday extended its ban on foreigners to contain the spread of COVID-19. The restrictions were due to expire on the 1st of May. However, citizens of foreign countries, including specialists who carry out maintenance of imported equipment, will be allowed to travel. In Russia, at least 1,000 people have died of coronavirus infection so far. There are over 1 lakh confirmed cases in the country. It's been 3 months since the World Health Organization alerted the world about the coronavirus pandemic by declaring it a global emergency. In the past 3 months, most parts of the world have been affected by the virus, which originated in China.
The outbreak of novel coronavirus was first identified in Wuhan in China as early as 17th of November 2019. But the WHO's Epidemic Intelligence System picked up the report about a cluster of cases of pneumonia of unknown cause in Wuhan on 31st of December 2019. On 5th of January, WHO shared information and advice to all member states to take precautions to reduce the risk of acute respiratory infections, raising concerns about human-to-human transmission. The 11th of January saw the first of many deaths due to the coronavirus. The same day, WHO published a comprehensive package of guidance on how to detect, test for and manage cases and protect health workers from potential human-to-human transmission based on previous experience with coronaviruses. 2 days later, the first case outside China was reported in Thailand. Later that week, WHO staff visited Wuhan and reported that the evidence suggested human-to-human transmission was occurring. Chinese authorities then took the radical step of locking down the city of Wuhan, and then on 25th of January, the whole of Hubei province, cutting off 56 million people from the rest of the world. 5 days later, on 30th of January, the emergency committee met and a global public health emergency, WHO's highest level of alarm, was declared. At that time, there were 82 cases outside China and no deaths. But that did not last for long, and on 15th of February, the first coronavirus death was reported outside Asia in France. By the end of February, the number of infections rose, notably in Italy, South Korea and Iran. On 6th of March, the number of reported cases worldwide topped 1 lakh. Italy became the first country after China to impose strict confinement measures on its population. On 11th of March, the WHO declared COVID-19 a pandemic and urged the world to take action. The WHO also declared Europe the new virus epicenter, and through the month of March, Spain, France and Britain imposed their own confinement measures. By 26th of March, the United States had overtaken China and Italy with the highest number of confirmed cases in the world. By 2nd of April, half of the world's population was called on or obliged by the authorities to stay at home. As April dawned, the global infections topped 1,060,000 people had died. As of 30th of April 2020, more than 3.2 million cases of COVID-19 have been reported in 185 countries and territories, resulting in more than 2,28,000 deaths. More than 9,72,000 people have recovered.
The national lockdown is shining the spotlight on many heroes who usually remain unsung. Some of them are Indian police personnel who are winning hearts with their compassion and exemplary acts of humanism. In the past weeks, there have been multiple visual testimonies of police personnel helping citizens in many different ways. Be it taking food to people, delivering medicines at their doorstep, and even celebrating birthdays. In Hyderabad, the police celebrated the first birthday of an infant after her parents requested them from the US.
Due to the lockdown, the baby could not join her parents who live in Boston. Similar scenes were seen in Panchkula in Haryana, where the police reached the house of a senior citizen to celebrate his birthday. The elderly man, who lives alone, could barely hold back his tears at the impromptu celebration. In Jammu, police personnel expressed solidarity with doctors and nurses by praising their tireless efforts in the fight against COVID-19. In national capital Delhi, the police found a unique way to thank the Bangla Sahib Gurdwara community for feeding around 75,000 people every day during the lockdown. As a gesture of respect, the police performed a siren parikrama of the Gurudwara. A similar parikrama of the All India Institute of Medical Sciences was performed by the Delhi Police's COVID patrol team as a gesture of respect towards the unwavering commitment of the doctors, nurses and other medical professionals. And not only are the police personnel spreading hope and positivity among citizens, they're also taking care of the animals. These are visuals from Ranigora in Odisha, where police personnel are feeding monkeys who've been struggling to find food due to the lockdown.
It's been 2 years since the Modi government's ambitious Ayushman Bharat scheme was launched on the 30th of April 2018. As part of the Gram Swaraj Abhiyan, Ayushman Bharat Divas is observed every year on this day.
The Ayushman Bharat Yojana, also known as the Pradhan Mantri Jan Arogya Yojana, was launched by Prime Minister Narendra Modi in 2018 to give every citizen access to quality health care. Under the scheme, a cover of 5 lakh rupees is given per family per year. Ayushman Bharat was part of the recommendations of the National Health Policy 2017 to achieve the vision of universal health coverage. It has been designed to meet the UN-mandated Sustainable Development Goals or SDGs and its underlying commitment, which is to leave no one behind. In February 2018, the government announced the creation of 1.5 lakh health and wellness centers or HWCs by transforming the existing sub-centers and primary healthcare centers. These centers were created with the aim of delivering comprehensive primary health care to bring healthcare closer to the people. HWCs cover both maternal and child health services and non-communicable diseases, including free essential drugs and diagnostic services. The second component under Ayushman Bharat is the Pradhan Mantri Jan Arogya Yojana or PMJAY. It is the largest health assurance scheme in the world with the aim of providing a health cover of 5 lakh rupees per family per year for secondary and tertiary care hospitalization, benefiting about 50 crore people. The scheme covers over 10 crore families in India, 8 crore in rural areas and 2.33 crore families in urban areas. As of 30th April 2020, under the PMJAY, over 12.45 crore e-cards have been issued. Around 98 lakh hospital admissions have occurred and more than 21,000 hospitals have been empaneled since the launch of the scheme. To strengthen the country's response to the coronavirus pandemic, the government has decided to make the testing and treatment for COVID-19 available under PMJAY. With this, more than 50 crore citizens will now be able to avail free testing through private labs and treatment for the disease in empaneled hospitals.
And in some unfortunate news, veteran actor Rishi Kapoor passed away early Thursday morning at the age of 67. His family said the actor, who had been ailing for the last 2 years, was jovial and kept the doctors entertained till the very end of his life. His family members also appealed to the fans and his well-wishers to respect the lockdown rules while sharing their grief over the actor's demise. Rishi Kapoor had a 2-year-long battle with blood cancer. He was diagnosed with leukemia in 2018. He returned to India last September after a year-long treatment in New York.
He was hospitalized in Mumbai on Wednesday morning after he complained of uneasiness. Tributes poured in from across the country for the veteran actor. People from all walks of life mourned his passing away on social media. President Ramnath Kovind, Vice President M. Venkaiah Naidu and Prime Minister Narendra Modi conveyed their heartfelt condolences to Rishi Kapoor's family members. Prominent personalities including actor Amitabh Bachchan, Union Minister Prakash Javadekar, actor Akshay Kumar and cricketer Harbhajan Singh also expressed their grief. Rishi Kapoor made his debut as a child actor in 1970 in his father Raj Kapoor's film Mera Naam Joker. His first role as an adult came in the iconic film Bobby, for which he won the Filmfare Best Actor Award in 1974. Rishi Kapoor played the romantic lead in dozens of films for over 2 decades, after which he made a successful transition to character roles. He acted in more than 120 movies. The versatile actor also delivered many incredible performances that spanned a wide range of characters. And besides his incredible acting abilities and comedic flair, Rishi Kapoor was also a skillful dancer. Some of his songs are all-time hits.
बचना ऐ हसीनो लो मैं आ गया ए बचना ऐ हसीनो लो मैं आ गया हुस्न का आशिक हुस्न का दुश्मन अपनी अदा है यारों से जुदा पायलिया हो पायलिया नींद चुराए होश उड़ाए मुझको पास बुलाए और अब्बा हो.
So that's it from us in this bulletin. Thank you for your time. Good night. Take good care of yourself.